Well, thank you all for coming out today. My name is Jeremy Arp. I serve as the Executive Director for NASW Washington State Chapter. I'm joined by a few folks here tonight. Linda and Angie will be serving as our ASL interpreters. And you can see them pinned here in the on your screen. We also have Diana Ferguson. She's Chapter Coordinator of Professional Education as well as Administrative Affairs with the chapter. And we also will have Syrene Miller walking us through the licensing process here in Washington State. So a couple of I guess, level setting here. We want to make sure that folks are muted, and if you don't want to be on camera, you can keep your camera off. If you can save your questions to the end. If not, you can enter them into the chat so we can kind of collect those to hopefully answer them one at a time at the end of the presentation. Our hope is that we can get through all of the information by 7:30 tonight, and very much appreciate you being here tonight. Without further ado, I'm going to go ahead and get Syrene Miller the floor. Syrene Miller is currently an associate licensee in social work with an MSW. Syrene served the chapter as both a board member, but also a membership engagement committee member, a conference planning committee member, and many more roles here with the chapter. I think on the board, Syrene served both as a student representative, an MSW student representative, having attended Boston University Online, and then also serving as an Eastern Washington representative. Currently, Syrene also serves as a district liaison and with the chapter too, helping organize some events around the state. So Syrene, I'll let you take it from here.
All right. Thank you. We're going to talk a little bit about licensure and the requirements for getting a license in Washington State, and then also resources through NASW for the process of getting your license in Washington. So the rules and laws can be found on the RCWs and codes, which is also called the Revised Code of Washington, on a website. I think we have links for this in the presentation. So the chapter 18-225 and then chapter 246-809 is the administrative code. And also there are policy statements and governor's proclamations. Was there anything else that you wanted to add to this, Jeremy?
Yeah, so with RCW 18225, that outlines the professions of social work, counseling, and marriage and family therapists. The Washington Administrative Code, Chapter 246-809, that is the rules. So when you hear RCW, that means laws, and that's what the legislature passes. Rules are what are passed to actually get kind of the functional part of getting the law to work. So that's usually through a different process, but it basically gives the law some way to operate. The DOH policy statements, that's the Department of Health policy statements, come out typically during public health emergencies and other times throughout the year. Interpretive statements are usually what those statements refer to. That is the department's interpreting things. Governor's proclamations, hopefully won't see a slew of these for a while, but during the pandemic, we had proclamations for almost every profession and every activity in your life for a little while. So I wanted to make sure that those were included on the slide too.
Yeah, so if you have questions about anything related to your profession, those are two areas that you can search online and typically find the information that you're looking for. So today we're going to talk about the 4 categories of social work licensure for Washington State, and then walk through the steps to apply for licensure in Washington. Also talk about some of the definitions for approved supervision, so that is clear and you're getting the adequate supervision in order to have the requirements met for licensure when you submit your final application. And then we'll also review the continuing education requirements. Okay, so Washington Department of Health is the administrator of the social work licensure in Washington State, and they break that down into 4 different categories. And 2 of them are related. So the licensed social work associate and advanced is related to the licensed advanced social worker, and the licensed social worker associate and independent clinical is the associate for the licensed independent clinical social worker. So you'll see these LSWAICs is the associate for the LICSW, and the LSWAA is the associate for the LASW.
And real quick, you'll see that folks will also write it out as LICSWA. I've seen it both ways. So just wanted to make folks aware of that as well.
Okay, so this is an important definition to acknowledge. The RCW in Chapter 18-225-10 states that advanced social work means the application of social work theory and methods, including emotional and biopsychosocial assessment, psychotherapy under the supervision of a licensed independent clinical social worker, psychiatrist, psychologist, psychiatric advanced registered nurse practitioner, psychiatric nurse, or other mental health professionals, as may be defined by rules adopted by the Secretary. Case management, consultation, advocacy, counseling, or community organization. And we'll talk a little bit more in the presentation about supervision and the requirements for that, because certain amounts of your hours have to be done with a licensed independent clinical social worker, and then others can be done by another mental health professional. Independent clinical social work means the diagnosis and treatment of emotional and mental disorders based on knowledge of human development, the causation and treatment of psychopathology, psychotherapeutic treatment practices, and social work practice as defined in advanced social work, which we just defined. Treatment modalities include, but are not limited to, the diagnosis and treatment of individuals, couples, families, groups, or organizations. So this is just going to differentiate between the independent clinical social work and the social work, advanced social work license. So RCW 18-225-005 states that LASWs and LICSWs represent different specializations within the social work profession. And so will differentiate that, with each license signifying the highest degree of licensure as it pertains to each specialty. Practitioners in each specialty exercise independent judgment and operate independently within their area of practice. Therefore, the purposes of job classification, LASWs and LICSWs licensed under this chapter shall both be considered the top tier of licensure for the profession. So associate means pre-licensure candidate who's working towards full licensure in their profession, has a graduate degree in a mental health field under RCW 18-225-090, and is gaining the approved supervision, supervised experience, and continuing education necessary to become a licensed independent clinical social worker, a licensed advanced social worker, or a licensed mental health counselor, or a licensed marriage and family therapist. So associate licensure is the first step in becoming licensed and is a requirement for full licensure. So the requirements for all associate licenses is the completion of a master's or doctorate social work educational program that must be accredited by the Council on Social Work Education. And that's usually identified somewhere in your program as a CSWE. And so if you're applying for programs, you want to make sure that you are going to an accredited program. The completed application that is signed and dated, and the application and initial licensure fee that is sent to the Department of Health. In addition, you'll have to complete out-of-state verification forms sent directly from each state if you are transferring existing documentation or licensure. Official transcripts are sent directly to the Department of Health from the School of Social Work where your degree was obtained.
And just one thing to throw in here would be with the CSWE accredited education, typically your social work programs nationwide are CSWE accredited, but Syrene makes an important point that you'd want to check. Note that doctoral programs typically are not CSWE accredited. So in statute this last year, they did change it so that way doctoral programs were included if they were in social work. So it's one of those things that you'd have to work with the Department of Health on to make sure if you were planning to go the doctoral route. Typically going the doctoral route, folks will get an MSW along the way. So that's usually not an issue, but if it is an issue, reach out to DOH.
Okay, so the next step for the licensed associate is to begin accruing the necessary hours of supervised employment, approved supervision, and continuing education necessary to apply for full licensure. And it is important that you have your associate license prior to having your supervision begin so that it is, because there are forms that are required to submit to the Department of Health to verify your supervision and your supervisor. So associate licenses are valid for 1 year and must be renewed every year on the date of issuance. And the associate license allows associates enough time to complete their required hours of employment, approved supervision, and the continuing education requirements to apply for full licensure. And as noted here, in 2024, there were some legislative changes around requirements for social workers and licensure, and the 6-year renewal limit was eliminated. So there is no limit on how long it takes you to get to full licensure requirements. Okay, so now we're going to move on to the LASW requirements. So the required hours for the LASW are 3,000 employment hours, with 800 of those in direct client contact. DOH has previously advised that for purposes of documenting direct client contact in advanced social work, client can be at the micro, meso, or macro levels. And so it'll be important that you're outlining who the client is when you're documenting your direct client hours. Approved clinical supervision for the LASW is a 90-hour requirement, and 40 of those hours need to be in one-on-one supervision, and 50 can be in either one-on-one or group supervision. And in addition, there's a requirement for 36 hours of continuing education, with 6 of those being in law and ethics. For LICSWs, this is a new one since 2023. The employment hours are 3,000, with 1,000 of those hours in direct client services and under the supervision of an LICSW. And so this is really critical to recognize when those hours and who's supervising those hours so that those hours are approved and recognized as supervised towards your license. Clinical supervision requires 100 hours of supervision. 70 of those hours need to be with an LICSW, and that 30 can be with another licensed mental health provider. Of those 100 hours, 60 hours can be in one-on-one supervision and 40 can be either one-on-one or group supervision. And they also have a continuing education requirement of 36 hours with 6 hours in law and ethics. Both licensures require an exam following the completion of your requirements. The exam for the LASW is a passing score on the Association of Social Work Board's Advanced Generalist Level Examination. And exam requirements for the LICSW is a passing score on the Association of Social Work Board's Clinical Level Examination. And I know for the LICSW test, it's 170 multiple choice questions. So just a review of the flow or chain of events that are required on your path towards licensure. The CSWE accredited master's or doctorate of social work degree is your first step. Then applying through the Department of Health, an application for one of 2 associate credentials, depending on your pathway, either the LASW or the licensed social work associate independent clinical. The accrual of the minimum hours of supervised employment, approved supervision, and continuing education over a period of not fewer than 2 years is needed to apply for full licensure. And once you have that information completed, then you'll apply for full licensure at the Department of Health, and that can be done online or via mail. And then they will approve you to take the ASWB examination once they qualify all of your documentation towards your licensure. And then they'll send you a link to be able to take that test, and then you'll pass the ASWB examination, and they will notify the Department of Health within 2 weeks, and then you will be have full licensure. So supervision is a critical aspect of getting your full license. So you want to make sure that this is done appropriately so that you're not paying for supervision that doesn't qualify. So per the WAC 246-809-334, prior to the commencement of any supervision, the supervisor must provide the licensed candidate this declaration stating he or she has met the requirements of WAC 246-809-334 and they qualify as an approved supervisor. So this is really important that you have supervision with a supervisor that meets the requirements of the Department of Health. The form that is provided by the Department of Health states that as an approved supervisor, they attest they have completed the following, which is a minimum of 15 clock hours of training in clinical supervision obtained through either a supervision course, continuing education credits on supervision, supervision of supervision, or any combination of these. The declaration form also attests that they have 25 hours of experience in supervising clinical practice, and they have 2 years of clinical experience post full licensure prior to being a supervisor. The part 3 of this declaration also attests that the supervisee's practice activities that will be supervised and that the supervisor will have a thorough knowledge of is the practice setting, record keeping as outlined in WAC 246-809-035, financial management, ethics of clinical practice, a backup plan for coverage. And this form is completed by the supervisor and provided to the licensure candidate prior to the commencement of any supervision. And this is also a really good thing to ask about when seeking employment. Some employers provide supervision as your employment as an associate. And so that can be a really valuable resource when you're looking for your first job. So continuing education, Washington law requires all licensed social workers, including associates, to receive and document their continuing education. 18 hours per year is the minimum for associates to have in order to renew each year. And every other year, 6 of those CE hours need to be in professional law and ethics. That is a requirement every other year. So of those 18, every other year, 6 of them should be in law and ethics. Associates must have received these hours after completing the academic requirements and prior to the department issuing their full license. Acceptable CE courses include distance learning, seminars, workshops, and postgraduate institutes. And I'm going to put a plug into NASW here because NASW offers fabulous courses, especially in professional law and ethics. And they are a great resource for continuing education in any of the practice modalities or interests that you might have. Since 2014, at least once every 6 years, all licensed social workers, including associates, must complete a Department of Health approved training program in suicide assessment, treatment, and management. NASW meets those requirements. So that's another great thing about NASW is you can be assured that they meet the Department of Health's requirements when you take their law and ethics and their suicide assessment, treatment, and management courses. Recent social work graduates can delay the completion of their first training required for 6 years if you have taken an approved course no more than 6 years prior to an application for initial license. So some clinical programs in your master's degree or your doctoral program may have a similar program that might meet that requirement. Telehealth training from Washington is required if you're doing telehealth, and health equity education is also required, and that is 2 CE hours. So there are quite a few resources that are available. Washington Department of Health Social Work Licensing has great resources on the Department of Health. And there's that link. Association of Social Work Boards has practice tests and testing materials that you can either purchase or review for free. NASW Washington State also has lists of CEs, opportunities to be involved, networking with both students and professional social workers. There's some great resources for taking licensure exam. I took one last April to help study for my exam, and it was excellent. And then the National Association of Social Workers National is also a great resource for both CE and other resources for social work students and professions.
And just a quick note, Syrene, with the Department of Health Social Work Licensing, that's kind of a long address. So if you wanted to Google it, that's how I usually go. I usually Google DOH-WA and then social work licensing, comes right up in the first result. And also with the NASW Washington website, that is our old domain, but it still redirects to our new website, which is not quite as long as the Department of Health's frequently asked questions site, but it will get you there for the years to come. So wanted to point that out.
So I just want to have a disclaimer of that this is an informational only resource. We're not providing legal advice. And that it's important to check with NASW or with the Department of Health because rules and laws change regularly. So if you've been practicing for a long time, make sure that you are practicing to the most recent WACs and RCWs. The Department of Health is the authority. NASW is not the regulatory authority for social workers. And so any questions regarding your license can be directed to the Department of Health, although Jeremy and NASW Washington are a wealth of knowledge and have a great resource and ways to answer some of those questions. Department of Health is the governing body and authority for licensure in Washington State. Okay, so next we'll have question and answers. And also I want to turn some time over to Jeremy to talk about the social work compact. And also that licensing changes state by state frequently. And so if you are planning on being licensed in multiple states, it's important to know the licensing requirements for the states that you'll be working in. There's also other categories of licensure that also affects like the LICSW. If you have experience working in SUDP, that also affects your hours. I think it drops to 2,600 hours if you have so many hours in that field. So make sure you're checking if you are licensed in other areas. How that impacts your social work license. And then beginning January 2021, healthcare professionals, excluding physicians, who are offering telemedicine services to patients are required to complete the telemedicine training. And there are resources for that on the Department of Health for that.
Okay, and Syrene, did you want me to read the questions for you?
Yeah, do you want to talk about the social work compact for a minute?
I'll do that real quick, and I just want to promise folks that we will get to your questions. I will talk quickly but distinctly for our ASL interpreters too. Real quick, in the past, there were limits on distance supervision. That is, when you were being supervised by your clinical supervisor or your supervisor in a behavioral health setting, there was limits placed on that. Those were eliminated during the pandemic with House Bill 1007. Part of that was through NASW's advocacy during the pandemic. That was in 2021. There's also limits on distance education. And when the laws and rules refer to distance education, that would be education that you take online or correspondence courses, things like that. That was limited to 26 hours per reporting period. That was waived during the public health emergency, but there's permanent rule changes that will institutionalize that. So Department of Health continues to take 100% of your hours for continuing education from online sources. Two other big bills that passed was House Bill 1724 in 2023. That was the bill that basically took the hours of for the LICSW from 4,000 to 3,000 hours and went from 130 to 100 hours. That was something else that NASW had advocated for to be in line with the Interstate Social Work Compact. The compact is an agreement between states that allows you to have the privilege to practice in another state as long as you obey their laws for your scope of practice. Kind of like a driver's license. You're able to drive into Idaho or Oregon or Utah because all of our states have an agreement with one another that they will honor the other state's driver's license. So currently, Washington was the 4th state to pass the social work compact. The chapter was very involved with getting a sponsor, making sure that folks were at the table at the legislature, and same with the Department of Defense was a real advocate as well. That passed in March, and there's currently, I think, 12 states that have passed the compact. only 7 states were needed for it to activate. House Bill 2247 passed last session, but I'll get a little bit more into that in the next slide here. But just know that the Social Work Licensure Compact was a big accomplishment for our chapter. Note that we're looking at alternatives to exams as part of the 1724 work. That is House Bill 1724 charged the legislature or charged the Department of Health with identifying barriers to licensure. One of the barriers was identified as the ASWB exam. Based on the data that was released in 2020 through 2022, it basically showed that there were massive disparities between different demographic groups. And so that was seen as implicitly biased exams weren't particularly measuring the what they wanted to measure. So NASW and other stakeholders are working with the Department of Health to identify possible alternatives. And so if the Compact Commission adopts those alternatives, that would be something that NASW is really pushing for. You can find out more at swcompact.org. 1724, the bill that passed a couple of years ago, also created additional credentials for agency-affiliated counselors. We wanted to include that here. The scope of this presentation is a bit limited, so just know that there are different pathways to practice in behavioral health settings, including agencies. So that was the bill that charged the Department of Health with identifying the barriers. The continuation bill in 2024 legislative session was House Bill 2247. The bill basically last year created a stipend program to pay for out-of-pocket supervision expenses. It changed with this bill to be a stipend program for supervisors to apply for rather than the bigger audience of supervisees. So that's currently in rulemaking right now. This bill also eliminated the 7-year associate renewal limit and allows for associate billing, which is currently moving forward too. It also removes CE requirements from statute, yet it retains the CE continuing education and rules. So that's something else that NASW is watching closely because we feel that continuing education is very valuable for professions. So that said, Syrene, do you want me to start reading the questions here? I know people are entering some great questions here.